Welcome back to DuctTales. You know we love diving deep and getting into the nitty-gritty. And, this chapter in What Doctors Don't Know About Breastfeeding is no exception.
Yep, chapter 6.
Birth interventions.
Big one.
It is a big one. So we're really going to be focusing on how these common medical things that happen during labor and delivery, things that we sort of take for granted,
Right.
Can really impact, sometimes surprisingly, breastfeeding.
Yeah.
And I think, we've got some great articles that you shared with us, and your notes are awesome.
Thanks.
And it's just really eye-opening to see what Dr. Newman and Andrea Polikova, what they're saying and why breastfeeding can be such a struggle for some people right from the get-go.
Totally. And I think what they do really well in this chapter is connect the dots between the interventions and the natural processes of breastfeeding.
Right.
And, sometimes what we assume to be true, actually there's a lot more to the story.
Yeah.
There's a lot more nuance.
For sure. So that's what we're going to be talking about today. And I think really our goal is we want to give you the information to, make informed decisions, separate fact from fiction.
Yeah.
And, be your own advocate for your breastfeeding journey.
Exactly. And what strikes me right away in this chapter is how Dr. Newman and Polikova, they really emphasize, based on their decades of experience, how crucial it is to understand that these routine interventions that are often so well-intentioned can sometimes really disrupt these really intricate hormonal and physiological processes that are essential for establishing breastfeeding.
Right.
And I think that's where the lack of understanding among medical professionals, comes into play.
Yeah.
And it can lead to a lot of preventable difficulties.
For sure, for sure. Okay, so let's get into the specifics because the chapter talks about a lot of different interventions. One of the first ones they talk about is, pain medication during labor.
Oh, right. Big one.
Big one. So how does that affect the baby, their ability to breastfeed right when they're born?
Yeah, so it's fascinating. So the authors explain how pain medications, particularly opioids, can cross the placenta and affect the baby.
Right.
And so they bind to these receptors in the baby's brain, and it can actually make them a little bit sleepier.
Oh.
Yeah, so instead of that, really alert, wide-eyed, rooting reflex, ready to latch on, they might be a little bit drowsy and have trouble coordinating those sucking and swallowing movements.
Right.
Which are so crucial for that initial latch.
And, I think what's interesting is that it makes sense now because, my first baby I had an epidural, my second baby I didn't. Yeah. And my second baby latched on so much easier.
Yeah.
It was just like, boom. And I was like, oh, this is totally different.
Yeah, it makes a huge difference. And while the chapter doesn't necessarily single out specific medications, they do emphasize that any medication that affects the mother's central nervous system can potentially have an impact on the baby's alertness at birth.
Right. It's not just about, one specific thing.
Right.
It's about the overall effect.
Yeah, the overall impact.
Okay, so let's talk about another one. Induction or augmentation of labor. This is a very common intervention.
Yeah.
And how can this potentially affect breastfeeding, both for the mom and the baby?
So this is where the hormonal interplay gets really fascinating.
Okay.
We often think about just getting labor started, but we don't always think about the downstream effects.
Yeah.
So induction and augmentation, they often involve using synthetic oxytocin.
Right.
Like pitocin.
Okay.
And, while it stimulates those uterine contractions, it doesn't perfectly replicate the natural pulsatile release of oxytocin.
Right.
That happens during spontaneous labor.
Okay.
And natural oxytocin, it plays this huge role, not just in labor, but also in triggering the release of prolactin, which is essential for milk production.
Okay.
So the authors suggest that this difference in that hormonal signaling can sometimes lead to a delay in that copious milk supply coming in.
Okay.
Even if the baby is born vaginally. And on top of that, in induced or augmented labor can be more intense or prolonged.
All right.
And potentially lead to a more stressed baby who may not be as ready to breastfeed.
That makes sense. Okay, so let's switch gears a little bit and talk about cesarean birth, which is, a major surgery.
Absolutely.
So what are some of the breastfeeding challenges that often come up after a C-section, and how can we best support moms in these situations?
So a cesarean birth definitely presents a unique set of challenges.
Right.
First and foremost, the mother is recovering from major abdominal surgery.
Yeah.
Which can affect her mobility, her comfort level, even finding a comfortable position to breastfeed.
Right.
Pain management is a big factor.
Yeah.
And then there's the immediate skin-to-skin contact that we always talk about.
Right, yeah.
Which is so crucial for initiating breastfeeding.
Yeah.
That can sometimes be delayed because of the surgery and the recovery process.
Right.
And so the chapter really emphasizes how important it is to prioritize skin-to-skin contact as soon as it's medically feasible after a C-section.
And to have support people there who can help facilitate that.
Oh, absolutely. Moms who've had a C-section often need that extra support from lactation consultants, nurses, their partners, to help them find comfortable positions, like the football hold or side lying.
Yep.
And also just to help them recognize those early feeding cues.
Yes.
Because, babies can also be a little bit sleepy after a C-section.
Right, because of the anesthesia, right.
Exactly.
Yeah. Okay, so this actually leads into a really important point that the authors make, which is the significance of immediate, uninterrupted skin-to-skin contact. They seem to be emphasizing this as the most important thing.
It really is the cornerstone.
Yeah, so tell us why.
So the authors are very clear. Immediate skin-to-skin contact right after birth. It triggers this amazing cascade of physiological benefits for both mom and baby.
Okay.
For the baby, it helps regulate their temperature, their heart rate, their blood sugar levels.
Wow.
And crucially, for breastfeeding, it allows the baby to have immediate access to the breast. They can start exploring, initiating feeding, using their innate instincts.
Yeah.
And newborns, they often exhibit this incredible behavior. They'll actually crawl towards the breast and self-attach if given the opportunity.
Oh, I've seen videos of that. It's amazing.
It's amazing, isn't it? And so routine procedures, things that we do in the hospital, like weighing, measuring, bathing the baby,
right.
If those are done away from the mother, they can really disrupt this very sensitive and time-dependent process.
Right.
And this chapter really advocates for delaying those non-essential procedures to allow for that first hour or even longer.
Right.
Of uninterrupted skin-to-skin. They really emphasize that this first hour is not just cuddle time. It's a biological imperative for breastfeeding.
I love that quote. So, thinking about everything that we've talked about, obviously the authors have so much experience and they've seen so many cases. What are some of the overarching messages or sentiments that they're trying to convey, even if we don't have specific quotes in front of us right now?
Yeah, I think they're really highlighting that this one-size-fits-all approach to birth interventions often doesn't consider the delicate balance that's needed for breastfeeding to really get going.
Right.
They've probably seen countless examples, even if we don't have specific quotes, of how these seemingly small interventions can snowball into breastfeeding difficulties.
Right.
And then those difficulties are often misattributed to the mother or the baby.
Right, right. Like, oh, you're not trying hard enough, or the baby's just not latching well enough.
Exactly.
Right.
And I think what they're calling for is a more individualized, nuanced approach to birth.
Right.
One that really prioritizes supporting the natural processes of labor and breastfeeding whenever it's safe to do so.
Right, right. Okay, so to bring it back to our listeners, this isn't to say that all interventions are bad.
No, bad about it.
It's more about just understanding the implications and being informed.
Absolutely. It's about knowledge. It's about having those open conversations with your healthcare providers and asking those questions about what impact different choices might have on your breastfeeding journey.
Yeah, and really advocating for what you feel is best for you and your baby.
Exactly. It's about being an active participant in your birth experience and knowing that you have choices.
Right. And also, I think, having resources available to you like lactation consultants, support groups, things like that.
Well, absolutely. Having that network of support is invaluable.
Yeah. So, what we've really unpacked here in Chapter 6 is how our approach to birth can really affect breastfeeding.
Yes.
And that these routine interventions, while they may be medically necessary, sometimes they can unintentionally disrupt that natural process.
And I think that's the key takeaway. Awareness.
Yeah.
Just being aware of these potential impacts can help you make those informed choices and really advocate for practices that support you and your breastfeeding goals.
Right. It's complex, it's nuanced, and I think, like Dr. Newman and Polikova emphasize, it's about continuous learning and looking at things holistically.
Absolutely.
Both for parents and for the healthcare providers.
Yeah.
So we've talked about how pain medication, induction, C-sections, separation, all of these things can pose unique challenges. Hopefully, this has given you some food for thought, some things to consider as you prepare for your own journey.
And remember, knowledge is power.
Yes, it is. So as you continue thinking about this, what resonated with you? What questions do you still have?
Yeah, what are your biggest concerns? And how can you start those conversations with your healthcare providers to advocate for the birth and breastfeeding experience that you envision?
And speaking of more to think about, in our next deep dive on DuctTales, we're going to be tackling Chapter 7 of What Doctors Don't Know About Breastfeeding: Dehydration and Weight Loss After Birth.
Ooh, that's a big one.
It is a big one, so we'll be diving into those common anxieties around how much weight newborns lose and how dehydration sometimes is just misunderstood, especially when it comes to breastfeeding.
Yeah, lots to unpack there.
We hope you'll join us.